A very common problem that I see at the Recovery Village is treating patients with cocaine and/or crystal meth abuse and dependence. These two drugs are so addicting, and there's a very short time where you go from experimentation to full-blown dependency. Some of the signs and symptoms you may see with someone who's using amphetamines and stimulants is that they're kind of hyper, very hyper. They oftentimes will go periods of time without sleep. For cocaine, it's so expensive that they maybe start selling away some of their properties, etc., to get more money for cocaine. For amphetamines, it seems to be much more readily available. People are making it, you know, in their garages, and that's scary because you never know what you really are getting. Actually, you don't know what you're getting with either drug. The problem with it is because they're stimulants, they rev up the body, and you can have complications such as strokes, heart attacks, which could lead to death. And so the other problem is because they're so addicting is people continue to use them and use them and use them. Medically, they become anorexic, not like an anorexic nervosa patient, but lose their appetite, and that in itself can have a series of health problems associated with it. Treatment at the Recovery Village for cocaine and amphetamine abuse is multifold. First, we clearly evaluate them medically, making sure that there's no medical complications from their drug use. The detoxification itself is really supportive therapy, and we really observe people, put them in a quiet place, let them crash, so to speak, from their high. Feed them, give them nutrition because that's been oftentimes neglected, and then a few days later really try to assess what's going on, who do we have here. Oftentimes I'll see someone after they've crashed, they're very depressed, may have a lot of anxiety, a lot of shame and guilt afterwards, and so we really start on the therapies of what led someone going from a casual user or a non-user to a full-blown addict.